all my viewers once again on this live program today on Heart Mitra. It's always a pleasure to connect with all of you through these live programs. Not only we publish data or information for you on a daily basis to keep you informed about the latest happenings in the field of cardiology, but also we invite for you leading cardiologists from across the country who can talk to you as a friend and answer the questions which you have in mind. Today, I am very glad to welcome two of the stalwarts in the field of cardiology from the city of Vijayawada. We have Dr. P. Raghuram and we have Dr. Sudarshan Subramanya with us. Welcome to the program.
Thank you.
Thank you.
A lot of our viewers, they generally ask about that if the stenting is happening or some other procedure is happening to them while they have faced any cardiovascular issue, then how does the recovery path look like, and what and how they should be taken care of at home. For doctors also, it is very important that the patients they follow the guidance. And today we will be, sir, using your expertise to talk on this subject, and I will put some questions of the patients for you. But for all my viewers, before I start taking your questions, let me formally introduce to you both the speakers. We have with us Dr. Raghuram, who is an interventional cardiologist, and he works currently at Ayush Hospital at Vijayawada. After doing his master's in medicine in 2011 from prestigious PGI Chandigarh, he completed his specialization in cardiology, and for last 9 years, he is serving his patients in the field of cardiology. And also we have with us Dr. Sudarshan, who is again an interventional cardiologist working at Ayush Hospital at Vijayawada. And he did his DM in cardiology in 2016 with a gold medal from Andhra Medical College. And both of them have many publications as well to their credit. So we know that today we are talking to the experts who can really help us on this. Sir, to begin with, let me bring in Dr. Raghuram to begin with, and if you can help us understand, sir, and set the context, and let us know, like, which are these patients who actually undergo cardiac stenting, and what is done actually to these patients while during this procedure.
Yeah, first of all, thank you for the opportunity, Heart Mitra. Very excited to speak live. And so coming back to the question, which patients undergo stenting and what actually does happen to them? So generally, stent is nothing but a metal tube which has some drug coating inside. There are different makes from different companies all over the world. It is basically used to clear a clotted or a clogged blood vessel, open it, improve the blood flow, and to prevent again the vessel getting blocked, we put a stent. Majority of the times, this is done in patients with heart attack. Heart attack is nothing but when a blood vessel suddenly gets the blood flow gets stopped because there is a clot formation in the blood vessel and the blood flow suddenly stops. That leads to a heart attack. So the best form of treatment available today in the world is immediately clearing the clot and keeping the vessel open and improving or re-establishing the blood flow. So we do this by using these stents. So basically, either through their hand or through their groin, right groin or left groin, we send small wires and pipes through which this stent is sent. We visualize it, the heart on the X-ray, with the use of some injections or some contrast injections. We visualize the blockage, we go open the block, we clear it with some balloons, and then we place the stent and we ensure that the blood flow is re-established again to the heart. This is the best form of therapy available for cardiac patients or with suffering from heart attacks. And not only heart attacks, we sometimes have to use these stents in patients even without heart attacks who have chest pain, who have breathlessness, because of these blockages in the heart. Heart attack, the basic difference between a heart attack and just a block is whenever a blood vessel is completely blocked with a blood clot, it is heart attack. But there can be another scenario where there can be blocks like 80%, 90% blocks, with which the patients have problem, like they have chest pain, they have breathlessness, and such patients also can have minor heart attacks, may not be a major heart attack. These patients also, they require stents. In some of the patients, when they have multiple blocks and they are also unfit for surgery, rarely in these patients also, because of their age extremes or other comorbidities with when bypass surgery is not possible. In these patients also sometimes we have to do these stents.
Okay. So basically, what you are telling to our viewers is that whenever someone faces an heart attack and he reaches an hospital, and if there are arteries which are blocked, then you open them up, and then stents are the things which are generally put in that vessel to open it up so that there is a regular blood flow which is happening to the heart and to the cardiovascular system.
Correct, correct. Well summarized.
Yeah.
Thank you.
Thank you so very much for helping us understand this whole thing. And maybe I can invite Dr. Sudarshan here and learn a little more about that when a patient undergoes this kind of a procedure. I'm sure it's a major procedure. So how many days does the patient has to stay in the hospital, and then what is the recovery path after that? What are the things you guide a patient while you're discharged?
Yeah, as described by Dr. Raghuram, we see the patients how he present to the hospital. That means whether he presented to the hospital in an emergency situation or is he a stable patient. For example, if the patient had a heart attack, that means it's an emergency. So everybody says that time is muscle. Time is muscle means as you kill the time, you are also concomitantly killing the heart muscles, which does not have the capacity to regenerate. So you have to establish the flow in certain point of time. Let's take for example that guidelines say that vessel has to be opened as early as possible. Let us say guidelines say that 1 hour is the best time, where if you open the vessel, the patient will recover to the full extent. And if you are getting late, that means more and more muscle gets damaged and more complications he might has to face. So if the patient presents us to an emergency in an emergency situation, let's take for example like in a case of heart attack, maybe he has to stay in the hospital for at least 3 days, and we'll see how he recovers. That means after the procedure also will have some amount of effects on the patient. Let's if you give more and more amount of contrast, might be his kidneys also might be at the risk of getting damaged. So we do watch all these things. If the patient is doing good, usually we discharge on the third or fourth day of the procedure. And if the patient is not in an emergency situation, then we discharge on the next day of the procedure. And recovery is, as I told you, if the patient is in an emergency situation, he presented to us to the hospital, it might take a couple of weeks. That means somebody may recover in 2 weeks, or somebody may recover to their full extent in a month.
Hmm. Okay. So I think here's a very, very important point mentioned by Dr. Sudarshan here, that time is muscle, and earlier the patient reaches the hospital and the doctor is able to intervene, then less is the damage to the heart muscle, and therefore the recovery would be faster. But then, if we delay or patient reaches late, then the damage is more, and of course recovery also will be a little longer. So as you mentioned that generally anything between 2 to 4 days is a time when you keep the patient in hospital. But in the same breath, let me also ask you, Dr. Sudarshan, that when you discharge a patient, so as a doctor, as a cardiologist, what are top 2 3 things on your mind which you are worried about and which you very very carefully tell to the patient that he should be taken care of?
Yeah, that's a good question. That means a couple of things we tell the patient more and more. One thing is we alert the patient not to skip the medicines, because medicines are the groundwork on which we prepare a big building. So medicines are the basic things which he should not forget, because medicines has to be taken lifelong. And 1 year, for the first 1 year usually we give some more medicines. That means medicines at a higher power. So after that number of medicines would come down, and after that depending on the situation of the patient, we might say that he shouldn't do strenuous activities. That means he should take some adequate rest, and he should take care of the diet. That means he should choose a diet in a way that that doesn't put him at much higher risk. That means fried foods and all those things are not allowed after stenting and these emergency procedures. So he has to be mindful about the diet and medicines.
Okay, so three things. Medicines are very important, which he needs to continue. Sternus activities should be careful of, and then the dietary measures which you told. And we will come and talk about this in detail little later. And let me invite Dr. Raghuram here and said, like, what's the recovery path now? Patient has undergone a procedure, relatively is okay, is comfortable at the time of discharge. Doctor has guided on these, two, three things. So how does he, recovers back? When can, how much time does it take for him to do, his daily course in the routine way? Or, and how much time he can properly walk or drive or go back to work? What's the recovery path, and, how do you, what can you guide us on this?
Sure, thank you. As already said, this again depends on the patient's clinical condition. That is the most important thing which decides on the recovery path. So, what kind of a rehabilitation program in each patient is suggested or prescribed depends on their clinical condition. It varies from patient to patient. We cannot forget that. For example, an elderly female patient with a severe heart attack may take a month or so, or maybe more than that, to even move from her bed. At the same time, a young man who smokes, who had a recent heart attack with a stenting, if he is determined, if he is recovering well, maybe he can get back to his work in a week's time. So it depends, basically depends on the clinical condition of the patient. So usually when a patient presents with a major heart attack and a successful procedure, a stenting or a bypass surgery or any kind of a intervention is done, which is successful, and if is discharged in a stable condition, usually they can resume their normal activities within 2 to 4 months. But mind everyone that this 2 to 4 weeks time is not fixed for any patient. It depends on their particular clinical condition. At the same time, this may not be equal to like full recovery. Mentally, complete physically also, some patients may take more time. In the west there is a certain cardiac rehabilitation programs which the patients are actually enrolled, which is not very developed in our country yet. But that kind of a cardiac rehabilitation program should be more taken forward, and all the patients, depending on their clinical conditions, should be enrolled into these rehabilitation programs, and they should be given very clear instructions regarding their exercise, their work activities, their diet, their medical drug compliance, their lifestyle. Everything should be taken into account. Thank you.
Okay. No, I think that's very important and very, you clarified this in a good way. I also want to mention here to my viewers that Heart Mitra not only educates you through the social media channels, but there is a Heart Mitra's cardiac rehabilitation program, which is absolutely, free of cost for people who have undergone heart failure and stenting. So you can always talk to your cardiologist about this. This is made for you. But Dr. Raghuram, also if you can, guide us a little more on, uh, especially the diets, what kind of absolutely do's or don'ts which you inform to your patients while they are on the recovery path. And I'm sure even the exercise or the activity which they have to take has to be in a graded way. So can
Correct.
you help us a little more about the dietary advice and the activity schedules you give to your patients?
Yeah, thank you. This is a very common question we get from our patients. Diet is something which is very much variable across the country. Even if you take in the state, the kind of diet people consume varies from place to place. So it is very difficult to tell our patients like what kind of food they should take. It's not very easy. But in general, the recommendation now is that whole plant based diet is the best diet one can follow after any cardiac illness or ailment. What I mean by whole plant based diet is the diet should be rich in fiber, less of the processed foods. What I tell my patients frequently is take anything which is natural or raw. Try to avoid processed food like oily food or more of animal fat containing foods. and also like starchy foods or a more complex, I mean more carbohydrate rich food. I advise them to take balanced diet. That there are patients who take non-vegetarian majority, so I we advise them to cut down on it. Like they need not completely stop, but at least they should cut down on the consumption. They should be taking more raw food, avoiding oily diet. At the same time, regarding the physical or exercise, graded exercise, which is recommended for these cardiac patients, is they should start exercise according to their doctor's supervision or prescription in a graded manner. They cannot go to gym within a week of a heart attack. It is not possible. It is not recommended. So according to their clinical condition, probably their doctor is the best judge when can they start their exercise. But most of the patients without severe heart failure or major heart attack, they can start their routine activities as well as some kind of a mild exercise like a brisk walk or a mild jog in within 2 weeks. For example, is there any problem like a heart failure or a lingering still cardiac ailment which needs more time to recovery? Probably their doctor is the best judge who can advise them when to start the exercise in a graded manner. Thank you.
Okay. I'm sure all this information which Dr. Raghuram has shared regarding the dietary plans and the graded exercise would be very, very helpful for our viewers and the patients at large. Dr. Sudarshan, if I may, bring you in here and ask you one of the most commonest questions which patients has. Should they be looking out for some emergency signals? That if something goes wrong, I'm sure it's a major procedure, and while they are at home, they would always be worried nothing should go wrong. So, what are those signals they should be looking out for, which should compel them to immediately talk to their cardiologist without wasting any time?
Yeah, that's a most pertinent question, which most of my patients do also ask. That means they should be mindful about their symptoms. That means usually they should look for any kind of chest pain which they might be experiencing in the previous admission, or if they are having some amount of breathlessness, or if they are developing any kind of palpitations, that means racing heart like feeling, or if they are having some amount of sweating happening whenever the patient is having chest pain, they should be mindful of that. And as Raghuram said, we should patient should be inculcating a graded form of exercise. If at all the patient is having any kind of symptoms which I described previously while doing exercise or during the rest, then shouldn't hesitate to ask his doctor.
Yeah. So I think that these are very, very important points, and I'm sure our viewers who have or someone in the family has undergone stenting, or if someone undergoes this procedure, while discharge, the doctor will always provide you an emergency helpline number as well, where you can always call back. So if there are any symptoms, as Dr. Sudarshan mentioned, you don't assume or don't wait for too many days that okay you will go after a week or month. Immediately call up that number and have a conversation. You may need medical help immediately, so don't ignore or overlook that. In the same breath, Dr. Sudarshan, if I may also learn from you and ask you, many times when after such a procedure patient goes back home, there's an extra care which is given to a patient. He is like asked that okay you stay in one room on the bed. So many times they feel isolated, and there are a lot of psychosocial issues also which build up. So do you get such incidents, and how do you guide your patients on this thing, that should they isolate themselves to avoid infections or worries, or should they socialize with the family members?
Yeah. Isolation, I won't recommend to any of my patients. He can stay with his family members. He can spend good time, and apart from that, moving around in the home and doing his common chores. All these things depends on the clinical setting in which the patient is. If the patient is, let's take for example, he had a major heart attack and his heart is also so weak, then I would usually recommend them to stay in the home for a couple of days or weeks. That means if the patient is able to lie down without any kind of discomfort, usually I would recommend at that point of time to move around in the house, do his normal activities, do participate in household chores. If at all, if he is also doing all these activities without any discomfort, I would encourage them to go for a small walk. That means usually most of the patients come to us in a state where they are not used or habituated to the proper lifestyle. They won't be exercising that regularly. So I usually tell them not to start in a vigorous manner. Be slow as possible. That means start with, let's take for example 2 or 3 kilometers an hour walk, and I encourage them to go gradually, increase that 2 or 3 kilometers speed to, let's take for example like 4 or 5 kilometers. That would be an ideal way of doing that. And also I do advise them to be calorie conscious. You should be mindful about what you are eating, as described by Dr. Raghuram. You should match both of the things, how much you are eating and how much you are spending. And depend, if the patient is recovering well, if he is coping all these activities, then he can participate in his job and all those activities.
All right. So I think these are again very important things. There may be a tendency of feeling low, and if you keep yourself isolated, then further it won't help your mental health well-being as well. So based on your doctor's recommendation and guidance, move around in a graded way and keep yourself mentally as well healthy. That will further help your heart as well. So, Dr. Raghuram, if I may, ask you about the medicines, like Dr. Sudarshan talked about one. This is another important pillars. So now, what about medicines? How long a patient needs to take the medicines after he has undergone the procedure? Is it lifelong he has to take, or is it for a particular duration? What happens if a patient misses the medicine? Can you help us understand a little more on this?
Sure, sure. Uh, the duration of medication again depends on the kind of illness they are having. Some of the like, because we are talking particularly about stenting, post cardiac stenting care, majority of the patients they might have to take some of the medications, a few of the medication lifelong or indefinite, such as aspirin or some kind of a statin, like any kind of an atorvastatin or a rosuvastatin. These are the basic medications, basic medication which we might have to continue lifelong. But there is an intense phase, like 6 months to 1 year, after the procedure, during which the patients have to be very particular and very keen and very they should be following very carefully with their medication. This intense phase may last in some patients only 6 months. In some of the patients, it may extend up to 1 year. As our the science and technology are improving, now we are coming up with better and better designs in the stents, so that such that our duration of the intense phase is coming down. So, on an average, after a heart attack, majority of our patients need to take multiple drugs. That is the intense phase, and it lasts for 1 year. After 1 year, majority of our patients might have to just continue on 1 or 2 tablets depending on their comorbidities. If a particular patient has uncontrolled diabetes, uncontrolled hypertension, their medications might increase. But this again is dependent on the lifestyle modifications they inculcate in their routine to control these comorbidities. Thank you.
Okay. So basically, there are medicines which you may have to take in an intense phase initially, which you should not miss, and some you may have to take lifelong as well. So if you can also, Dr. Raghuram, help us understand, like, medicines are important for this patient. Now, if he undergoes some other problem, there are, I'm sure, sick day rules. If someone picks up, let's say, a fever or some respiratory infection, and he goes to another doctor, a general practitioner, then he may prescribe him other set of medications. So what he should do, and even in extreme cases, someone may have to undergo some minor surgery, let's say for an eye or a foot or anything. So what's your guidance to the patients in such a situation? That should they stop the medicines which you have prescribed and take other medicines, or both have to be taken in tandem? What's the guidance here?
Yeah. So it's not at all a good idea to stop medication, particularly post cardiac stenting, without notice of your doctor. uh, some of the times, like if there is an emergency situation arises, like the patient needs an emergency surgery where it becomes mandatory to stop the post cardiac stenting drugs. It can be done depending on their doctors, under their doctor's supervision. But most of the times, like medical ailments like fever or a running nose or some kind of an infection or some kind of a foot infection or diarrhea, majority of the times the cardiac medications need not be stopped, except in some rare scenarios where early in the post operative period the patient requires an emergency surgery. And it becomes mandatory for the patient to stop cardiac medication for him to undergo surgery successfully. That should be done under the supervision of his cardiologist.
Okay.
Also,
So I think,
yeah, please go ahead, sir.
yeah. So no, I think this is very important message for the viewers that whatever medicine your cardiologist has prescribed you post stenting, please don't stop it on your own without talking to your cardiologist. So
Yes,
you know
certainly.
there may be certain situations like if someone has to undergo a surgery or something, then the surgeon may ask you to stop it, but then that should also be done only in consultation with your cardiologist. Otherwise, it may impact your the stent which has been placed in the heart. Okay, sir, I think we are also now running out of time, so I'll maybe put in the last question to Dr. Sudarshan, and it's about I'm sure this patient once he has got an heart attack and he has got the procedure done, so what he should do, or what as a doctor you advise to ensure that there is no second heart attack happening to him, and the chances are minimized or reduced to an extent whether he keeps healthy overall.
Yeah, this is definitely a pertinent question. That means usually by stenting, we are just reducing the blockage. We are not at all preventing the future heart attacks. That means people always have this habit of saying that I went to a hospital, I underwent stent procedure, my treatment is done. So your treatment is not done. If I have to say, your treatment just started at that point of time. So, in order to prevent the second heart attack, you have to take care of your lifestyle. That means you have to take care of your lifestyle diseases also. That means if you are, you should cut down on your risk factors. That means if the patient is diabetic, he should put his sugars under control. If he is a hypertensive, he should take proper care of his hypertension, BP. And if he's a smoker, he should avoid any kind of smoking, either active or passive smoking. And if he's having some amount of high cholesterol, he should cut down, and he should be vigilant of his cholesterol levels in his blood. And he should take care of daily exercise habits. He should preferably take most probably the plant-based diet, which everybody knows that this is the good diet, or everybody recommends that this is the good diet to prevent or put the patient in a proper health. So if the patient takes care of his lifestyle habits and lifestyle diseases, then we can say that he can prevent the future heart attacks to the extent of 90% with all the medicines which he might be using.
Okay. So I think I'm sure our viewers will keep this in mind. Uh, Look, end of the day, if someone has suffered a heart attack, you have reached the hospital in time, and your doctor has done a good job in saving you, then I think as much a responsibility a doctor has in saving you, I think every patient and the caregiver also has an equal responsibility to take care of himself and follow the compliance and the guidance which is given by the doctors, so that not only you recover fast, but also you live a healthy and a long life and avoid the chances of another such incidents. So uh, I must thank you here, both of you, Dr. Raghuram and Dr. Sudarshan. I think this has been
Thank you.
a wonderful advice and guidance to our viewers on this. But before I conclude this whole program, I must thank all my viewers who would have joined us live today, or who would be watching this program later on as well, uh, uh, as this program will stay here. So, if you have anyone in your family who has undergone a cardiac procedure or who has a cardiovascular problem, you can simply share the link of this program with them, and this discussion can be very, very useful for them. If you live anywhere in Vijayawada, Andhra Pradesh, Telangana, you can always travel down and meet Dr. Raghuram and Dr. Sudarshan at Ayush Hospital if you need more advice. But if you are listening to us anywhere else in the country, in some other city, so don't ignore your cardiac problems, even the smallest of issues if you have. Immediately connect with your nearest cardiologist, because to begin with, one of our panelists mentioned that the time is muscle. Earlier you pick it up and take help from a doctor, you will save your muscle and your heart. So with this, thank you, Dr. Raghuram, Dr. Sudarshan.
Thank you,
Thank you
Dr.
so very
Musa.
much for joining us.
Thank you.
Thank you, Sandeep.